Duc Giang General Hospital, the former Zalem General Hospital, was established in 1963 after several times of being renamed. In 2023, the hospital was officially named Duc Giang General Hospital. In September of 2011, the hospital was regarded as the top-class hospital among other hospitals in Hanoi. With a long history of caring for people's health, the hospital has completed its historic mission to be a solid rear in the war against the Americans, to serve the battlefield, to take care of people's health during the years of fierce war. After the Independence Day, the hospital has more favorable conditions to improve. Many members of the party, doctors and nurses during their times have taken care of the patients and dedicated to the growth of the hospital. Over 50 years of development, Duc Giang General Hospital has changed completely in both quality and quantity. Anyone entering the hospital nowadays will be surprised by a spacious infrastructure being built beyond modern architecture to ensure the beauty of civilization. With 6 buildings ranging from 2 to 7 stories, both the interior and exterior of the hospital were designed in accordance with European standards. Over 50 years of development, Duc Giang General Hospital has changed completely in both quality and quantity. Anyone entering the hospital nowadays will be surprised by a spacious infrastructure being built based on modern architecture to ensure the beauty of civilization. With 6 buildings ranging from 2 to 7 stories, both the interior and exterior of the hospital were designed in accordance with European standards. You would be expected to see the reasonableness of architecture and the arrangement to achieve the highest productivity of each department, from the clinic department, the emergency department, to the treatment rooms and the administrative area. Everything was arranged separately and standardly. In particular, the building blocks are equipped with signage system, multifunctional and modern indicators in accordance with the quality standards and brand identity. All departments are well equipped with the most up-to-date medical and surgical equipment such as beds, bedside cabinets, injections, color ultrasound machines, digital X-ray system, especially 128 CT scanner, MRI machine, 1.5 Tesla, interventional cardiovascular machines, blood test machines. The board of directors during the times had always been made up of the party unions, the directors and vice directors of the unions. That is a solidarity and active group. The functional department consists of 10 specialized departments which have successfully completed the management tasks in order for the hospital to be fully developed as it is today. Proud to be the first-class hospital, Duc Giang General Hospital has a total of 44 departments with 500 inpatient beds. This staff includes more than 890 people, in which many of them are postgraduates, such as associate professor, PhD, master, doctor, and specialists. With the purpose of making patients' health is our most important priority, our doctors and nurses always trying to research and apply new medical technologies for diagnosis and treatment. 24 hours emergency department is always ready for all acute medical situations and all patients. All the doctors in emergency department, ICU, pediatrics, cardiovascular departments is always ready for all emergency cases. In the new clinic department, there are 40 rooms which are being in charge by our best specialists. Being the typical unit of healthcare system with the high qualification of medical equipment, the modern routine of examination in here is convenient for patients, which decrease the waiting time and ensure patients' satisfaction. There are 4 groups of specialized departments in the hospital which provide the highest quality of professional services. Group of surgery and obstetric with 7 departments: orthopedic surgery, general surgery, urology surgery, and anesthesia, department of obstetric and emergency department. In Duc Giang General Hospital, doctors and nurses can do almost every basic and modern surgical techniques such as knee replacement, reconstruction of knee ligament, spinal surgery, minimally invasive bone surgery under X-ray screen, arthroscopy of knee joint, shoulder joint, surgery of gastrointestinal disease, gallbladder, prostate gland, perforation of stomach, appendicitis, colorectal cancer, urothelial stones, kidney cysts, and other obstetric surgery such as ovarian cysts, ectopic pregnancy, endometrial hysterectomy. The operating rooms with modern and synchronous medical equipment system always ready for emergency surgery, scheduled surgery, and post-operative care at the ICU of surgery unit. Group of internal and pediatrics departments with 13 departments including ICU, internal department, pediatric department, ICU of pediatrics, neonatal cardiovascular department, internal infectious department, internal urology department, cancer department, faculty of traditional medicine, rehabilitation, department of neurology. Doctors and nurses in this group take care of most basic disease, manage chronic disease such as hypertension, endocrine, hepatitis B, cancer, detect and treat cancer chemotherapy, therapy, counseling for autistic children. Currently, many departments have been developing high techniques such as thinking and intervening cardiovascular, cerebrovascular, and vascular pathology, acute serious disease such as septic shock, poisoning, mechanical ventilation, nerve root blockade under CT scanner. In addition, Duc Giang General Hospital has implemented a closed cycle of antenatal care. The cycle closely collaborating with obstetric, neonatal, pediatric specialties had enabled clinicians to promptly detect, control, and treat more complicated cases. Intersectoral clinical units, ENT, dentistry, eye, plastic surgery, infection control, pharmacy have served patients from the routine to high techniques such as surgery, nasal cavity endoscopy, laparoscopy, cystic fibrosis, carotid VA, hammer, phaco surgery, amniocentesis, dry bone surgery, cosmetic shaping technique. Group of image diagnosis includes functional investigation, hematology and blood transfusion, biochemistry, microbiology, and pathology. The highest quality laboratory services, the quickest and most accurate results such as FT3, FT4, TS8, CE, PAS, Chopin-1, cell testing, bacterial identification. Apart from developing the treatment, many other activities for the hospital are also being developed, such as IT applications with the development of modern hospital management software, connectivity, storage, and transmission, internal data and reporting to regulatory authorities. Scientific research is also the hospital advantage with a great deal of research and innovative solutions, and that result in both professional and medical benefits. Quality management is also an asset of the hospital. The hospital has always been the top leader in many years of quality assessment and undertaken the leading position to contribute to the development of health sector in this respect. Furthermore, many other activities of the hospital are also expanded, such as innovative solutions, scientific research with dozens of research topics at graduate level and high level, applied IT in modern hospital management, software development, quality management. For many years, Duc Giang General Hospital has always been in the top of health sector in terms of quality, managing the lower level, receiving techniques from the upper level hospital. The issues of training the skilled workers with a certificate of employment in accordance with professional requirements are always our concern. International cooperation is also the strength of the hospital. For many years, Duc Giang General Hospital has been cooperating very well with the University of Lemos Institute while expanding relations with other hospitals in the region to contribute to training and improving the quality of human resources. All duties of a Class 1 General Hospital have been fulfilled completely in Duc Giang General Hospital. Indicators of medical examination and treatment, disease prevention, staff training, scientific research, international cooperation, and economic development have been achieved with the results higher than the previous year. The innovation of servicing attitude towards patient satisfaction is a regular activities which contributes to change the reputation of the hospital. Thanks to this, the hospital has achieved many noble titles of the city, Ministry of Health, and the government. At Duc Giang General Hospital, social activities have also been promoted by the party committee, the directors, worker unions, and youth unions to implement free healthcare program for beneficiaries. Special visits, examination, and distribution of drugs to the policy beneficiary in the capital under the direction of the Department of Health. The hospital also regularly responds to the humanitarian blood donation, provides support for flood victims, Vietnamese Heroic Mother, Children's Festival, Mid-Autumn Festival for Children, assist poor patients being treated in the hospital, and encourage patients to enjoy their life. With the perfect combination of those elements, high quality of doctors, dedicated servicing attitude, modern medical equipment, spacious facilities, staff quality of life has always been improved in the sense of working condition, as well as material and spiritual life. In the near future, we still have a long way to go, especially in the direction towards the reform of hospital management mechanism to emphasize hospital autonomy in all aspects. Duc Giang General Hospital, however, strives to continuously improve its reputation as the first-class hospital of the city and its comprehensive and reliable healthcare services for the people of Hanoi and the Northern area. Duc Giang General Hospital keeps trying to make this slogan for real. Taking care of your health is our happiness.